afternoon, everyone. This is Becky McLaughlin from Kleer. We're going to let some more people log on here before we get started, but we'll be starting just shortly in a couple minutes. And again, we'll be starting in just a minute or so as people log on. All right, we're going to get started here. We have a good amount of people on the line, and some will continue to join in. Hi, everyone. Again, Becky from Kleer here, and we're so happy to join CNC Dental in presenting on the topic of doubling the value of your uninsured patients with a membership plan. All callers are on mute and will remain on mute during this presentation. But send us your questions using the Q&A feature in the GoToWebinar platform, and we'll make sure we address them during the last 10 minutes or so of the presentation. We have two awesome experts on the line today. I'm going to take a moment to introduce them to you, and then I'll go ahead and hand things over to them. First, you'll hear from Dave Monahan, CEO and founder of Kleer. Dave has a passion for creating technology-enabled businesses that improve people's lives. He founded Kleer and championed its mission from the beginning. He designed the Kleer platform based on dentist and patient feedback, curated a brilliant and hardworking team, publicly advocates for dentist and patient rights, and continuously pushes the company to innovate and be better. Prior to joining Kleer, Dave served as the president and CEO of FitLink, a leader in the wearables market, where he created simple, affordable, and connected wearable devices for the medical and sports market. He also worked at Microsoft developing new products, market, and partnering strategies that help the company and thousands of its partners enter new markets and grow. He received his Bachelor of Science in Mechanical Engineering from the Pennsylvania State University and an MBA in International Business from Loyola University. When Dave is not coaching or spending time with his family, he finds time to exercise, travel, and play any sport or competitive activity he and his friends dream up. Dave, thanks for joining us. And we also have Tim Healy, founder of CNC Dental, on the line. Tim, great to have you on here as well. Known by many as the marketing mastermind, Tim has a passion for helping small businesses grow. Since graduating from Texas Tech University in 1987, he has learned how to market everything from coffee to fresh vegetables to gasoline. Fortunately, he has spent the last 20 years focused on teeth. Tim and his wife, Mariella, enjoy cruising North Texas on their Harley-Davidson Deluxe, and they stay very busy with 4 daughters and a home in Frisco, Texas. Again, so great to have both of you on the line today. I'm excited to hear how we can double the value of uninsured patients with a membership plan. And with that, Dave, I'm going to let you take the floor.
Great. Thanks, Becky. And thanks, everybody, for joining us. As Becky said, I'm going to go first, and I'll talk about some things we've done at Kleer and what we've learned about membership plans. And I'll hand it over to Tim about really covering how to market your membership plan and sort of promote it out to your patients. And so, and high level, here's a quick agenda. So I'm going to go over why implement a membership plan now. So why does it make sense at this point, given the COVID-19 crisis? Why do they work? What type of results do we typically see? And some best practices we've learned. And then, like I said, Tim's going to go over how you can market your membership plan. So without further ado, I'm just going to jump right in. And what we have been trying to do is we sort of are looking for a reference point when you think about the COVID-19 crisis and sort of trying to model it. And one of the things that a lot of people model it off is the Great Recession of 2008 and 2009. So we went back and took a look and tried to compare the two, contrast them. and we found some overlaps and also some differences as well. But first, and no surprise here, I think everybody knows this, jobless claims are through the roof. And actually, this was as of April 22nd. It just got updated today. It's over 30 million jobless claims. The whole Great Recession, so 2 years of the Great Recession in 2008 and 2009, only about 8.7 million jobs were lost. And that was a big deal back then. So we're already over 3 times the Great Recession, and it's probably only going to get worse. Now, hopefully those jobs are, some percentage of those jobs are coming back fairly quickly. But the net is there's been a major impact, obviously, on job loss. Again, no surprise, but the magnitude of it is something we need to really think about. Here's some good news when you go back and take a look at the Great Recession. And we've seen this, by the way, during other crises as well. What's here is, and this is a study done by the ADA, and they went back and looked at about 6 years or so, 5 or 6 years prior to the Great Recession, and then post the Great Recession, what happened to dental visits. And the blue line is visits, percentage of the population in the U.S. that visited a dentist and a general dentist. The green is orthodontist, but I'm just going to focus on the general dentist for this. And what you see is, about 41% back in 2003. It was sort of going down a little bit, probably leveled in at about 40 or so. During the Great Recession, it only dropped 6%, or really just a couple percent. So it went from about 40% to 38%. And then it sort of leveled off again. It's climbed a little bit since then. But the net is, I think most people are surprised at how little of an impact the Great Recession had on dental visits. Basically, dental visits were very close before, during, and after the Great Recession. So that's a piece of obviously good news. So now here's, I'm not sure, this is a bit of bad news, but it's also something you can address, and we're going to get into how you can address this. So, patients were coming in very close, during the recession, after recession, as they were prior to the recession. The question is, did it impact the way they were paying? And the answer is it did. And so what you see here is the green is after the recession, the blue is before the recession. I'm sorry, the green is before the recession, the blue is after the recession. And what you see here, the first group of things here is how much of the total payments came from cash paying patients to a typical practice, how much came from private insurance, how much came from Medicaid, and how much came from other. And what you see here is the out-of-pocket or cash paying percentage of payments dropped from 46% to 41%, while private insurance went up from 45 to 47. And so the net is there was just, obviously, again, not a surprise here, but there's obviously pressure on cash paying patients. And as a result, more higher percentage of payments for a typical dental practice came from private insurance, just because the cash paying patients just weren't buying like they were, prior to the recession. This is obviously, going to be worse, given those job losses I went through in the previous slide. It's going to be even worse. So you're going to definitely see pressure on cash paying patients. There's going to be no doubt about that. So as you think about when you're reopening your practice, sort of what can you expect? So from your patients, one is, which is very different than the recession of 2008 to 2009, is there's a backlog of treatment. And depending on how long you've been closed, it could be 2 or 3 months. It could be less than that. Other states, some states aren't going to be closed that long. The net is that's very different than the Great Recession. During the Great Recession, practices were still open. So there's backlog. And by the way, I've been talking to a lot of practices, and they're seeing this. So practices that have started to open up, they're seeing, so far, the ones I've talked to are seeing a real good stream of patients coming in post, when they start opening up again. Now, with that said, you're going to have, less insurance patients, with those job losses, and there's going to be, in addition to job losses, there's going to be benefit cuts that are going to happen as part of this. That's really going to put, more onus back onto your cash paying patients if you're going to continue, sort of to keep your production up where it was. And so, you sort of need to take both of those things into account, and make sure you're offering something to those cash paying patients, or the ones who've just become cash paying who've lost insurance, giving them a way to purchase care that's budget friendly. And just as a sort of high level, from a percentage standpoint, now each practice will be a little bit different, but what we saw prior to the crisis was about 30 or so percent, 33% of patients did not have insurance who were coming in for care. If you think about the percentage of people who are going to be unemployed or losing benefits, it could be 10 to 20% of consumers are going to fall into that category. So you very well could be opening up to a situation where you have as many uninsured patients as you have insured. I think it's going to be very close to 50-50. So it's going to become, again, more and more important that you handle those uninsured patients in the right way and give them a way to purchase care. And obviously, so from a high level view, they're going to want to address these needs. They're going to have a backlog of needs, but they are going to be very price sensitive. There's no doubt about it, given what's happened. And it's not just that, people who've lost jobs or have had salary cut back or things like that. Even the people who got through it, without an impact on their salary, are still going to be cautious given the environment and not really, sort of this, sort of crisis environment is going to keep them from spending much money if they don't need to. So a membership plan, I'm going to get into the more important part is why do these work and then the results you can expect, but just want to introduce what a membership plan is. This just gives you an example of a typical plan. So typically a practice will offer one to children, one to adults, and one to perio. And I'm going to show examples of where you can customize this for your patient base, where you might have some unique characteristics of, younger patients, older patients, patients that have special needs, things like that. And you can really make this truly a custom, plan for your practice. But let me just pick this one in the middle. This is a typical plan where you have your cleanings, your exams, your x-rays, fluoride if you offer fluoride. You have discounts off of other procedures. In this example, they're giving discounts for multiple family members. So the next family member after the first would get a 10% discount off the subscription of $33 a month. In this example, they're offering monthly payments. You don't have to. That's an option. You can have the patient pay up front for it. But the net is you're designing this. You're in control of this. You're determining the price. You're determining what's included. We have practices who will add things like specialists to their plan and stuff and things like that. And so, there's a whole list of options you can add to your plan if you'd like. And what you're trying to do with this, which I'll talk about in a second, given the market research we've done and things we've learned, what you're trying to do is create a mutually beneficial relationship, right? Something that enables the patients to buy care from you and be loyal to your practice and continue to come back, but that also works for your practice. So you're in control. There's no third party telling you what you have to do. You're the expert. You're the one who went to dental school. You decide what type of treatment makes sense, and also what the pricing of that treatment is going to be. So critical to this conversation is, why do these even work, right? And what we did prior to setting up Kleer is we did a lot of market research, and we looked at, we talked general, just patients in general. Then we started narrowing, based on that research and the needs we found for our uninsured patients. And we started narrowing into that and really focusing on sort of what, how do they think about oral care? Why do they go to the dentist? What is sort of their sort of tipping points for buying care versus turning down care and things like that. And so what you're going to see here is the outcome of that research and some things we've learned since then. But here's just to sort of frame this up. I get the question a lot of time, well, how many uninsured patients are out there or uninsured consumers? And at a high level, 1 in 3 U.S. adults do not have dental benefits, and 2 in 3 U.S. seniors do not have dental benefits. And the reason it's higher for seniors is when people retire, Medicare does not pick up dental insurance. So the net is they're sort of thrown out of the dental care system in a way and have to go fend for themselves. And a lot of them never come back and buy insurance. They go uninsured. So prior to the crisis, there was about 150 million consumers without dental benefits. That's only going to grow. As I talked about before, there's another 10 or 20% of people who are probably going to lose benefits. So that number is going to get even bigger than that. So the net is it's a very large group of people out there without dental insurance. Now, the market research we did, we interviewed uninsured consumers one-on-one. We did focus groups where we'd bring them in around a table and talk to them. We also did a national survey of thousands of uninsured patients. And here's some things that came from that research. First is we want to understand, how do they value oral health? And the great news here is they give it a lot of value. They relate it to their overall health, their quality of life, and also that they will live longer if they have healthy mouths. So if you think about that, take a step back, you are offering an incredibly valuable service to your uninsured patients. They really value it. And a lot of that, the way I look at it is a lot of that sort of public messaging that's been out there for a while really has sunk in. And so you should feel really good about that they see value in what you're providing. Now, with that said, if you look at how often an uninsured patient actually goes to the dentist, over here on the left-hand side is patients with private insurance. So these are the PPO patients, basically. And roughly about half of them go to the dentist on an annual basis, which is really still low, right? I mean, that number should be really much higher than that, given that somebody's paying that premium. But net is about half of them go to the dentist on an annual basis. Over here on the right-hand side, it shows the uninsured patients. They go 17% of them go to the dentist each year. So you got to let that sink in, right? Only 17%. And it's obviously quite a bit lower than people with insurance. Probably not a surprise that that's that's lower, but typically people don't understand the magnitude of that difference. It's a monstrous difference. And so we wanted to understand why that was. And the primary reasons, and this is very consistent. This is our research we did in a national survey, but we also saw outside third-party research on this, and it validated exactly what we found. There's really two reasons, and they're very interrelated. One is uninsured patients think care is too expensive, and they also don't have insurance, which keeps them from going. And the two are obviously related, right? So when you talk to a patient about this who responded this way, they say, yeah, I don't have insurance, I don't have coverage, there's nobody looking after me, therefore I'm going to pay too much. So there's an assumption there. And so these two things are related. But if you ask them a more detailed question about, okay, tell me why it's too expensive. So what we would do is sit down and say, how much is a cleaning? How much is an x-ray? How much is a filling? And the net was they would guess 2 to 4 times higher than the actual cost. So when you really dig into this, it actually wasn't that it was too expensive in a way, because they really didn't know. What the real issue was, they were afraid of the cost. That was the conclusion that we came to, is they were afraid of the cost, and they didn't have a way of even understanding it, and they don't have coverage, so nobody's looking after them. Is sort of the net of all that. And by the way, I just put this little note here. I mean, this research was done prior to COVID. Post-COVID, this is only going to get worse. They're going to definitely feel like it's too expensive. They also, obviously, more people are losing insurance. So, this sort of attitude or whatever, mindset is still going to be there, and even, sort of worse than it was prior to COVID. So let's jump into the chair with an uninsured patient. And this is what we basically did. It was during these discussions and interviews, we were asking for how they felt. Give us your feeling when you're going in for dental care. And these are the things they said to us. They're very worried about the cost of care, and that it's obvious given that last slide I went through. This is another one that was interesting. They hate not having coverage. They feel in a way that they either let themselves down or they've missed the boat here, and they know they should have coverage, but for whatever reason they don't have it, and that doesn't feel good. They have no way of determining price. We talked about that on the previous slide, and they always believe they're paying too much. And the last one is really important. And you probably had patients who try to ask for a discount and things like that, but they are very uncomfortable negotiating fees because it's a healthcare service you're providing to them. They don't want to upset you or your team, and they don't want you to provide bad care because they're seeming like they're not a very nice patient or working with you. So they're completely uncomfortable negotiating fees. And I sort of summarize this into the what I think the overall feeling is, which is the feeling of exposure. They're exposed when they're coming into your dental practice. And to try to relate with this, because you may have had this feeling and been in this situation before sometime in your life. So, what does it feel like when you go to the mechanic and they say you need some type of part? You have no idea what that part is, what it does. You have no idea how much it costs, but you just have this person in front of you saying you need it, right? And you got some thinking to do, as this guy is doing in this image. And there's really only two options at this point, and I always say neither one of them is good, right? So there's one option, which is capitulate and just say, all right, get it done, and it's $1,000, and you have no idea if it was a smart purchase, a bad purchase. You don't even know if that person's putting the right part in. You have no idea, right? So a really bad feeling. The other option is you say no, and this feeling may be even worse, which is you get back in the car, you drive out of the lot, and you don't know if your car is going to continue to work, and what it's going to cost you if there's going to be more damage because you drove off of that lot, and now you have another thing you got to get done right in your day. So neither one of those options is a very good one. It's very similar to the feeling that your uninsured patients have when you're suggesting treatment to them, and they don't have any way of thinking about is this smart or not, and am I being savvy or not by making this purchase. Here's the really good news from the market research. So this is based on the national survey we completed. And so what it's showing is the level of interest of uninsured patients in purchasing dental coverage. And we explained to a very high level dental coverage is cleanings, exams, x-rays, and discounts off of the treatment, things like that. and 89% of them had some level of interest, from slightly to moderately to very and extremely, which was incredible, right? I mean, anytime you get 90% interest in something, it's sort of off the charts. But my opinion, given some research I've done in the past, the actually more impressive piece of this is about 50% are either very or extremely interested, and that's a huge indicator of intent to buy. And we see this every day with our practices on our platform. Right off the bat, 50% of patients are buying the membership plan, and then you have some selling to do in this moderately, slightly interested, and that will depend on how well you're good at positioning the plan and sort of their needs. But the net is you have a very, very captive audience who wants this type of plan and will buy it if it's positioned to them properly. Now, caveat on all of that is they said, I want dental coverage, but it needs to be simple, it needs to be transparent, it needs to be affordable. And what they're really getting at is that's what I'm used to in the rest of my life, in that, you think about subscription services that they buy and memberships are part of. If you had 3 words, it would be simple, transparent, affordable is what, those plans look like. So they're asking for the same thing for dental coverage. And their experience here, by the way, is anything but that. So, if they, either don't have, coverage and they feel completely exposed and they don't know how much things cost, obviously, that's not, simple, transparent, or affordable. On the other side, some of them have experience with insurance and they know those things aren't simple or transparent, and most aren't affordable. But one of the comments, one of the people we talked to said is, look, I know if I sign up for that insurance, it may look like a good deal, but they're going to get me. Now, those are the 2 words, they're going to get me, was the comment the person made. And I think that really summarized how people think about, insurance plans. They want something, obviously, that's more, aligned to other things they have in their life that aren't complicated. One of the reference points we used when we started building up Kleer in the platform and sort of the things that provide value both to the patient and to the practice was a couple books that were written a while ago, The Automatic Customer and Membership Economy. And I recommend you go look at these if you're interested in sort of the details of why membership plans work. But what these books basically, they say a lot of things, but 2 of the things that really resonate with me is memberships work if you have a market that has repeat business from customers who have other options. And I can't describe dentistry, like dentistry just fits into that definition, right? For obvious reasons. But the key to a successful membership plan is to create a long-term mutually beneficial relationship. That's sort of the net of it, right? And I'm going to get into that more and more as I go along here and show sort of how you do that. But it basically gives members or patients in this example, access to products or services that are simple, in a simple way that's convenient, right? And that's sort of the net of it. I want this, just make it simple for me, make it convenient for me. And what ends up happening on the other side is companies who will do those things have more loyal customers, and those customers purchase twice as much. And you can go in and look at these books. They have all kinds of studies across all kinds of different industries. And the net conclusion of these books is any market that has this characteristic will be a membership economy sort of type of business eventually. And I think, now's the time for a dental market to move there. If you try to, think about the membership plans that you might be a part of and the subscriptions you might be a part of, these are just a sample of some I'm involved with. And when I take a step back and look at this, what I realize is, I am really loyal to these memberships. So it's rare if I don't stay at a Marriott. If I'm going somewhere, I'm looking for a Marriott first because of all the rewards I get for doing that. It's hard to find anything but Starbucks coffees in my hand in the morning. They've got me hooked in, the coffee I like, but also I have these rewards that I constantly get, right? And they bring me back. They make me feel like I'm part of the Starbucks, whatever family. Costco's another good one. Prime is the one that's my favorite, and that has me completely hooked. I was ordering a ton of stuff from them prior to COVID. I'm even more dependent on them now. It's just the convenience and the simplicity, and I don't have to think about it, right? And I trust that, things I order are going to get, delivered quickly. If there's an issue, they're going to take care of it. Think about your membership plan in the same way. You're trying to create that relationship and set of services where the patient just relies on you for their dental care, and they're a true member, right, of your practice, and they feel that. It's not just a transaction; they feel closer to your practice, and sort of what we try to sort of do is try to boil that down into a list of things that sort of show that that's happening. So what we call the membership club effect. These are things when we talk to patients after they have a membership plan, these are the feelings that they express. So the top three, the first three here are the most important. And it's, it was surprising to us how emotional this was. But the feeling good about, basically taking a step in the right direction on oral health, it was a huge emotion coming from this. So in the past, they may or may not, come back for hygiene. Now they've committed and they're, committed to the subscription and membership. They know they're going to come back, and so they feel like they're taking a good step forward in their oral health. This feeling of financial savvy is also a really important one. So as I described before, that feeling of exposure, now they feel like they're savvy. They're getting a deal, right? They're bought in, and you're providing them, good, whatever financial terms, and they're comfortable buying from you moving forward. And another one is this trust sort of emotion. So you think about other models they're involved with and the things they like about them. Direct is really important. Getting rid of that middleman, getting rid of all the hassles that creates. They like direct relationships, and they relate that to it's more simple, it's more transparent, it's more direct, like it's more what they want, right? There's less inefficiencies and issues to deal with. And obviously there's a bunch of things that come from that, like no deductibles, no annual maximums, and so on and so forth. But the net is, with all that stuff and simplification of all that, you're basically creating trust. And then some of them would talk about feeling special, and you can reinforce this by making patients feel good who are members when they come into your practice by thanking them for being a member. Some practices will give them gifts and things like that, but you're really making them feel really close to your practice. And then a peace of mind feeling by just having coverage. Now to the important part. So it's all great, right? So there's obviously reasons to do a membership plan. There's also sort of a we've seen why they work, but the question is, do they work, and what type of results do they get? So we work with thousands of dental practices. We're in all 50 states. What we do for every practice on the platform is we offer to look at their data on practice management system, and let us do an analysis of their insured patients versus uncovered patients versus patients on the Kleer membership plan platform. And we'll just compare sort of their activity, like how often do they come in, what type of procedures do they accept, how much do they purchase in services from dental practice, and so on and so forth. You can see, the study, it crosses all kinds of different practice types. These were completely random. We don't pick practices. We just offer this to them, and it crosses all kinds of different practice management systems, including the big three. Here was what was really shocking to us. So this is the average across the practices that submitted their data and gave us their data. Look at that number, 2.1x. So there was a 2x increase in production for the patients. The blue bars are the Kleer, patients who purchased a Kleer membership plan, and the reds are the uninsured and uncovered patients, or your typical uninsured patient. Remember I said in the the membership economy and the automatic customer books and their studies in other industries, they said that customers who are membership purchase twice as much. We are seeing exactly the same number. It's crazy. I just never expected it to be that close. And again, on average, what we see is about a 70% increase in hygiene per patient, and about a 2.3x. I just rounded 2 or so, but a 2x increase on treatment and an overall production increase of about 2. It really has a major impact on patients' behavior. You can see, like, here's some samples of the practices that submitted their data. You're not going to, it's not a stamp. Everybody's 2x, 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 right? There's going to be a range. So you can see it ranges from 1.6 here to 4, 1.8, 3.7, 2.1. It depends on a lot of different factors, why those are going to be a little bit different. But the net is the 1.6 is the lowest we've seen so far, increase in production per patient. If we go into, I would go into a few of those and just sort of dig a little bit and show you the type of membership plan they're offering and some unique things they did, just to show you, how you can customize this and make it work for your practice. So this is an example of a practice in Ohio. It's one office, it's insurance-based. They launched their membership plan in November 2018, and this data is for all of 2019. So from January of 19 to December of 19. They were very close to the average, a little ahead of the average. So almost a 2x increase in hygiene, almost a 3x increase in treatment, and a 2.4 in total production. So nice, obviously impact on their practice. Now, They're in Ohio. Their pricing is $24, $26, and $42. They did the most simple plan you can do. So this is just hygiene and discounts off of other procedures, and it's a flat discount. They're getting a 15% discount. You can do all kinds of things and add new things to this, like specialists. You can add family discounts and things like that, and so on and so forth. You can make these quite a bit more customized and offer more benefits, but they went with the most simple option, but got really nice results. If you go, I'm going to go to this next study, which is a practice in Northern California. They have 2 offices. They're insurance-based as well. They launched May 2018. This is for all of 2019, their data for 2019. What you see is they are very close to the average. So the average was 1.7 on hygiene, they're 1.6. I think treatment average was about 2.3 or 2.4, they're 2.2 and 2.1, so right on the average on production in total. Let's take a look at their membership plan. Very similar, they're only offering 3 plans. They are ranging their discounts by procedure category, so it's not a flat discount across all categories, but they are setting their discounts based on different categories, and patients can go look at this if they want, but the net is, you can, like I said, you can set them differently if you want by category. And they're also offering a 5% discount for family members. And then look at the price. So this is Northern California, right? So it's $33, $45, $50. If you go back to the one in Ohio, $24, $26, $42, it's quite a bit more expensive, but they're in Northern California. The other practices in Ohio, these prices work for them, and they're very different, right? So it just shows the need, right, to make sure that you're pricing this properly relative to your demographics and your geography. Here's a really interesting one. So this is a practice in Southern California. It's one office insurance base. Again, this is for all of 2019. And I'm showing this visit number for a reason, which I'll get to in the next slide. But their visits tripled between their uncovered and their membership plan patients. And so did their production. It was actually more than tripled. And why, people ask you, why such a change? Like, why such a major impact? When you see what their membership plan is, they did something very unique. So they have the child, the adult, the perio, but they added this other plan over here called Senior Club, and it's for patients over 65. It includes the same thing as what's in Adult Complete, but the difference is you can see it's a little cheaper, but that doesn't tell the whole story. What they did was the Senior Club, they discounted it from Adult Complete, but the Senior Club's visiting hours are 1 to 3 in the afternoon, when their practice typically has dead time. So they, basically gave the seniors an option to get, less expensive treatment during downtimes of the practice, and it worked really, really well. We have other practices that will have multiple child plans because they have different, types of children, and they have children as a larger percentage of their practice than some others. We have practices that offer DIP programs where they'll do things like add whitening and things like that. So you can be very sort of whatever, you can customize this and personalize it based on your patient base. I'm going to go through these. I'm not going to go through all of our studies, but here's another one. It's a group, it's 6 offices in Pennsylvania. They doubled their visits. They more than doubled their procedures per patient. You can see they more than doubled their treatment and more than doubled their production per patient. And then this is just a summary to try to give you an idea of what impact you might have with a membership plan. So we just took those results, the average of the results, and we said, okay, if a practice has, let's say, 250 uninsured patients currently, if they continue to be uncovered, based on this research we did, they would do about $146,000 of production in a year. If they were on a membership plan, they do about 306. So that'd be an impact of plus 160. And again, you can just sort of think about this and, based on the number of uninsured you have in your practice. So that, obviously this brings up a question of how does this work? Well, it's really simple actually, but it's you got to follow sort of the dots. So first, by having people join, you create this membership club effect. Patients become more loyal, they become more trustful. They also commit to their care, right? So they come in for their hygiene appointments. So they're coming in 2 to 3 times more often. And what happens when somebody's doing hygiene, right? That's where treatment comes from. So 75% of all treatment comes from hygiene. So by getting them in for hygiene, you see treatment increase. And it's a pretty simple sort of path, but it's a really important one. It's the one that we see over and over again. Just from a best practice perspective, I talked about a lot of this. Let me just see if there's things I haven't covered yet. So localize, like I talked about, make it personal for your patients. Make sure this thing works for both sides. Make sure you balance the value, and we help with this. Like, you don't want it too cheap, where your practice isn't interested. You don't want it too expensive, where patients aren't interested, and same thing on what's included and what's not included. You got to get a balance. You got to create something that's mutually beneficial. You need to be fully committed as a doctor in the practice. You have to commit to this and make sure everybody understands you've committed to it, and that goes through the organization. You got to do things like align comp for hygienists. You got to make sure everybody's been trained on how to talk about it. You got to offer to all uninsured patients. So these two are sort of tied together. You don't want to try to pick and choose which patients offer to, because you don't know who's going to accept what. And there's a lot of what I call latent opportunity in a patient's file, where they have things they want to do, but they don't have a way of buying it that makes them comfortable. So this unlocks a lot of that latent opportunity. If you try to pick and choose, you'll miss that opportunity. You want to look at these things on a production profitability standpoint, not just write-offs. You want to automate it. You want to make it easy for your team and your patients to use this, your membership plan, and buy it and manage it. And then it needs to be compliant. There's a lot of state and federal regulations out there to make sure you manage it, or sorry, you're regulatory compliant. This is my last slide, and I'm going to hand it over to Tim. So basically, Kleer, real quick, we just, our team helps you set up the plan, design the plan, price the plan. We have a platform that manages it, both from patient and your side, and then we provide everything you need from a marketing perspective, like tools to use in your practice. And everything can be done virtually, and implementation is free. I don't want to bore you with any more ads, but that's what we do, just in case you were wondering. With that said, let me hand it over to Tim, and Tim is going to talk about marketing your membership plan.
All right, can everybody see that slide, I hope? Perfect.
You're good.
All right. Thank you, Dave. I really appreciate that. A lot of good information there, and pretty exciting to see how membership plans are really helping with everything, especially in today's world with everything going on. I think that what we learned is that 50% of the population right now is uninsured. I'm taking a rough number from that based on the 1/3 that you kind of talked about earlier, and how we're kind of heading towards that 50%. So the reason I show these two pieces of pie here is that what we really want to talk about here is that really the big opportunity here is that half pie right there, that 50% of people that are uninsured. And also want to talk a little bit about how that half pie is 2 times more valuable. Going back to the numbers that you shared with us earlier, 2.1 times more revenue than uncovered patients is a big deal. And so a lot of what we're going to talk about here today is how we take that half piece of pie and make it into a whole piece of pie. It's like magic. So who does it work for? So really, it's a question we hear all the time is, will it work for my practice? And the answer is, it works for any practice that's built on relationships and loyalty. And if you've got long-term relationships, patients that enjoy coming to the practice and everything else, then this is the kind of program that I think would work very well for you. So in-network, fee-for-service, it doesn't matter. It's for anybody who really built their practice around loyalty and relationships. And one of the keys to growing membership is Mary, who we're looking at right here. And Mary is sort of an example for us of how you make sure that you have that right person on the phone. With the right person on the phone, it dramatically increases your chance of success with any type of membership program that you have. This is where conversion happens. If someone in your practice is great on the phone, then you have a great chance of having your membership program work even better. If you didn't see this presentation, this is something that we did, a recent webinar. We're happy to get that information out to you. But again, this is having your version of a Mary and making sure that she is properly trained or he is properly trained to ensure success with any kind of a program like this. So let's talk a little bit about the 3-phase approach. This is what builds that connection for you. So as we've learned, membership increases value of uninsured patients by 2.1x, right? That's the average. Could be more, could be slightly less, but 2.1x is kind of what we're looking at right there. When we look at something like this, in this particular case, on the right-hand side of the slide, we've got a new patient visit for $79. Now that gets attention, but we don't necessarily want someone to take us up on that offer. When you've got a Mary on board and someone's calling for that $79 new patient special, it's a great opportunity to talk about what it takes to maybe convert that person into membership, right? Going back to the examples that Dave showed earlier, the membership economy, what we've got here is a chance to talk about a $29 plan or a $31 plan, whatever it is, versus $79. Remember, people think in terms of, what the payment is that month. So if you can take someone who is uninsured and move them over to your in-house savings plan before they even walk in the door, that's a huge win for you and a chance to, get a patient that is potentially someone who's loyal that's going to come in outside of that actual special. Which brings us to the next slide. One of the biggest complaints that we see in marketing is that single visit. Membership is your biggest opportunity to turn that turn that single visit into a relationship. Many of you, if you think back to Groupon, I think some people even still might do Groupon, but we saw a lot of people doing Groupon early on when it first came out. And if you recall, the downside of Groupon is that you basically gave away your service, but you didn't give all your time, all your effort, all your commitment was the same. And so you were working very hard to try to get a new patient for really no money. And we didn't see a lot of return visits on those. There's a reason that we don't see a lot of people doing Zoom whitening Groupon specials any longer. And so that's kind of that Groupon story right there. But one of the ways to combat that single visit is through membership, right? Because membership helps increase loyalty, and that's what we're looking for here. There's other marketing that sort of has a similar effect. Direct mail is one. Again, what you're trying to do is build relationships through membership, and that's how we combat that single visit. So let's talk a little bit about pricing insights. This is where we may differ a little bit from Kleer. We don't care what you price at as long as you believe in it. And I think belief is the big thing that we really want to talk about here. Imagine if your entire practice was 100% based on your membership plan. That's the kind of commitment that you have to a plan like this for it to work properly. You want it to be equal or higher to your best PPOs. And remember, it's not a discount plan. Now, there is a discount that you may offer with this, but it's not about a discount plan. It's offering a high quality service for a reasonable price. So 4 things I kind of want you to think about here. And remember, people think in monthly costs. But we want you to think monthly, not annually. Again, people are buying things on membership, memberships, things like that. It's all really about how much you pay per month. You don't buy a new car or lease a new car for $50,000. You lease that car for $690 a month, for example. We see plans work anywhere from $19 to $44. And you saw the examples that Dave shared with us. It depends on a local market and what people are willing to do. And as long as you do your research and price your plan fairly and you believe in it, that's what it takes to really make something like this work. So we talked a little bit about that commitment. I mean, again, think if 100% of your people are on your membership plan, you'd have to be happy about that. And that's what we want to really think about right there. Because if you're not excited about it, then your membership plan really doesn't have any kind of a chance. So what do we want to emphasize about this? I think what's exciting is that this is the opposite of insurance. We do compare this to insurance, but it is not insurance. The big differences are there's predictable monthly fees, that transparency that we talked about earlier, no waiting, no exclusions, deductibles, pre-approvals. And I think something that's pretty exciting about this is it includes all your cosmetics, dental implants, Invisalign, orthodontics. You want to make sure everything's included in your plan. And so I think that this is a great way to generate sign up, right? Because you're not having to wait to get this. I mean, the moment you sign up, that you can enjoy that benefit from a plan like this. So it's the easiest way, if you think about it, to provide great dental care at a fair price. And remember, people, when we talk about insurance, it's one of those things that people feel is necessary, right? Because of the things we talked about. Uninsured people want coverage. There's an emotional commitment to knowing that you have a transparent plan that you feel is fairly priced, and that feeling of belonging. So these are all things that I think are really important to think about when you're talking about everything from pricing your plan to how that plan itself works. So there's a reason that we don't call it an in-house insurance plan. So where do you find members? These are your current and inactive patients, your senior citizens, your small business owners. We're going to go into more detail about those first 3 groups here in just a minute. But what we really want to talk about is, let's pick one on this slide. I think it's kind of an interesting one. It's that concierge MD client. Many of you are working through what we call concierge MD. You have a medical plan where you have a higher level of service. You're not sitting in the waiting room with everybody else. You get different attention. You get certain benefits from that kind of a visit. Think about this. If you're a member of a concierge MD plan yourself, wouldn't it be wonderful to talk to the person who's administrating that plan and see if that's something that you could do yourself? Like, how can I get to be one of your network providers for your concierge medical plan? I mean, that's a real win. And again, what we're talking about here is how do you market those plans? Thinking about, who do you want to be? How do you want to promote that plan? And a lot of times it's just thinking about the things that you do yourself, the things that you're involved in, and how you network within those groups. College students is another kind of an interesting idea there. We do have a client in a college town that has a friend that they went to school with that administers the college plan. And one thing that they kind of worked on together, which I think was a really cool idea, is they said, hey, let's take this in-house savings plan, this membership plan, and let's make it part of signing up to be a student here. So if you think about that, for whatever your plan price might be, now you've got somebody, who, if you're a parent and you're enrolling your kids in school, you got books, you got tuition, you got room and board, you've got all these expenses. Wouldn't it be cool to be able to check a box and for a monthly fee, your kids now have dental insurance and coverage and membership plan, I should say membership plan. They have a membership plan that they can now take advantage of in their local market. Now they're seeing their dentist like they should. They take care of all that while they're at school. So when they do come home, they have more time to spend with mom and dad. Something I would appreciate anyway. So let's talk a little bit about something that I think might be a little bit more controversial. This is one of our 6 niches here. But again, we go back to that whole idea of pricing a plan that you really believe in. And your current patients, not just your new patients, are a real big part of what you might think here. If we look at this piece of pie here, this is a startup practice that we work with. And this is a real snapshot from Dental Intel. And one of the things you see in that upper left-hand corner, that orange slice of pie there, is that you've got 32% of your patient base is inactive. So if you believe the research we talked about, if you know that, if you can activate somebody and they can spend 2.1 more times dollars on dental than they normally do, isn't that a great place to kind of focus energy and effort? If you just focused on that, if you could get 100 of those people converted, that's like worth a whole year of marketing to your practice, having those patients become active and spending more with you. So that's kind of what we want you to think about as you kind of look through this. So membership's a great way to reactivate those patients and put them in those active columns for you. Let's talk a little bit more about senior citizens. Now, 2/3 of senior citizens don't have dental insurance, according to the research that we saw before, and they obviously have a compelling need for dentistry. Another quick story here. We have a practice that's in Lincoln, Nebraska, that learned about a local organization, it's the Nebraska Retired Teachers Association, from a patient who was on a membership plan provided by the practice. And so the dentist got to talking to that patient a little bit and found out that the reason that that particular retired teacher became a member of the plan was because Medicare doesn't cover that. Medicare is basically for your medical stuff. And so there's not a lot of dental insurance or benefits to go around. And so talking to the patient and getting an invite into the Nebraska Retired Teachers Association, this dentist became a member of, not a member, but they became a presenter, an exhibitor for this particular organization. And membership plans have taken off to the roof. It makes a lot of sense, right? You've got people living on a fixed income. They're looking for something that's transparent, reliable, and they know what that fee is going to be. That fixed income is what really drives that whole thing. So that was a great opportunity. And so for you, you get to find your version of that Nebraska Retired Teachers Association and do something with that. So I also see the Senior Olympics on here. I think you saw my initial slide picture. I think I look much younger without my beard. This is my COVID beard right here. But I think I might finally qualify for Senior Olympics. So if we get to do this presentation again, I'll let you know how that goes. Last of our niches here, I think, is let's talk a little bit about small business owners. These are your current patients, and this is your biggest opportunity next to current patients is the patients that own small business, right? They've got their employees, their family members, all of that going for them, but they're under lots of financial pressure right now. So how do you get them on a membership? I think that, a lot of folks, we say, get out and drive around in your car, call chambers of commerce. There's all kinds of things you can do, but sometimes it's sort of that Wizard of Oz effect. It's, you're right there already. You've already clicked your ruby slippers, and there you have it. If you just talk to the patients that you have that own small business, what a great way to network and learn about those small business owners and what you can do to help, provide additional value. And so in an economy like we've got, anything that you can do as a small business owner to help keep your employees engaged, your team members engaged, and thinking that this is a great place to work, a dental membership plan makes a great way to do that as well. So no reason to drive around and cold call and all that kind of stuff. So that kind of brings us to our last slide here, is how do you do all of this? And there's an easy, obvious answer. You can call us. We can certainly help. If you've got a membership plan now, we can add that to your website. We can create a call out on your homepage to draw attention to it. There's lots of ideas on this page, but I think that what it really comes down to is how do you do all of it? It's great to go through a presentation like this, get excited about this, but when we turn off this presentation, then you go back to doing things as you have been. You need help with implementation, and I think that's where we really want to talk about is we can help, Kleer can help, but that's what it really comes down to. So let us help motivate you and take it from a great idea to something that actually works for you in your practice. One of the things that we're doing here today, and you'll see this in, I think, the next slide, is that we can help you build your membership strategy. We've got some ideas that help you develop a program that will help you add 100 new members to your in-house plan, your membership plan. Now, we don't guarantee you'll get 100 members, but we've got a way to take it from the idea phase to something you can actually do with it. So let's wrap up today with this thought, right? Think back about the research Dave shared, all the great case studies that he shared, everything we learned at the beginning of the presentation and throughout this presentation. And think about this, people on membership plans are likely to spend that 2.1 times more than they would if they're uninsured or cash pay patients. And I think that's what we want to think about, taking that half slice of pie and turning it into a whole pie for you. I think that kind of brings us to this last slide here. And I think that we both have something that we can share with you here. Dave, you have anything you want to share on your side there?
Yeah, so we, as I mentioned earlier, everything we do is virtual and it's all free to get set up. So you don't, this is the way we're set up. So COVID really hasn't impacted our ability to set a practice up. If you want to schedule a demo and you can just see the platform, you can talk to somebody live virtually. You can book that at clear.com. And then we have an ebook if you're interested. It basically takes that market research I talked about and it has it in that downloadable ebook. And you can, it's actually even have more details than I went through about some of that research I shared.
All right, so is it time for question and answer time?
Great, so Becky here again. It is time for question and answer. And we do have a handful that we'll try to get through here in the next 7 minutes we're on the line. The first one, Steve, I think is for you. What is a typical subscription price for a membership plan?
It's funny. Typical is a hard thing to answer. I can give you an average, and I talk about the range. I think Tim mentioned this as well. So average on our membership or on our platform across the whole U.S. is $345 a year. But that ranges, and Tim mentioned some ranges, and we actually see those ranges of about, some practices go down to $19 or $20 a month. Others are up towards $50 a month. Again, it depends on geo. It depends on the patient demographics. So there's a wide range, but the net average is $345.
Great. And here's another question, and Steve, I think this is you again. Does it make sense to offer a monthly payment plan?
Actually, I think Tim could answer that one. I'll talk about the sort of nuts and bolts of what we see on the platform, and Tim, you can probably talk about it from a marketing perspective. But nuts and bolts wise, it's interesting. So if you offer a monthly option, what we see is to millennials, almost every millennial picks it. It's like 80% of millennials will pick the monthly option if they're given both a monthly and an annual option. When you get to 65 plus, it's almost the opposite. It's not quite. It's about 60-40. About 60% of the 65 plus will pay up front, and they actually were, it seems like, and I don't know the psychology behind it, Tim, but it seems like they're okay. They don't necessarily want that hanging over the head, and they have disposable income, so they don't worry about it too much and just sort of pay for it on an annual basis. But that's sort of the nuts and bolts is, we typically tell practices to offer it because there's patients across the spectrum who want it as an option.
And I think we take a look at it from, we do a lot of different types of campaigns for our clients. And a lot of what we deal with here is, implants are a great example, or Invisalign. You've got a flat rate that you can market, but at the same time, if you look at that monthly fee, and that goes back to some of the things that you had mentioned earlier, that monthly fee is what gets attention. Now, if they want to pay it for it annually, if you want to offer a discount for an annual membership, that's fine, but your platform takes care of either way. I think from a pure cost standpoint, that lower number gets attention, and then you can walk that person through whatever they want to do that makes sense. So I think that, in my opinion, you look at the monthly fee to get attention, and then you can go through the different options on how you want to pay after that.
Yeah, it makes a lot of sense.
There's another question here related to monthly payment plans. What is the payment default rate for monthly payment plans?
Good. So yeah, we typically do get a lot of questions about monthly. It's funny. It's like one of those things where I think people get it, and then they say, "Well, what's the sort of downside?" And are people actually going to pay it? And we get a lot of times people will say, if they sign up monthly, does that mean they're going to get the first visit and you never see them again, and you don't get your monthly payments down the road? So I assume that's what this question is sort of aligning to. And what's really interesting, a couple things for us on the membership on the monthly payment side. So we actually collect 3 months up front when somebody signs up on a monthly basis, and it's just to make sure that they're serious about this and they're not trying to just pay it for a month and get out, get their cleaning and get out. So you get some coverage on that first visit. It's usually pretty close to cost, but the other thing is that we also do a pretty good check on that whatever card they're using and make sure that it's a good card that has the whatever the cap needed to make that monthly payment month in and month out. We actually only have, once somebody signs up on a monthly plan, only a 1.5% default rate on monthly payments, so it's incredibly low. But the positive side, so you might have a little bit of a default rate on that, which typically, by the way, is typically because of stolen cards and lost cards. What's incredible about the monthly plans, though, is when they come up for renewal, almost every monthly plan renews. And I think it has a lot to do with what you talked about, Tim, which is, oh, it's $30, right? I'm fine with that. When you have an annual lump sum renewal of $350, that takes a little bit more of that people are going to look at it, right, and make sure that they want for that to go through before they approve it. So net is there's a lot of positives on the monthly payment model, plus the default rate is very low.
Mm-hmm.
Great, and we've got a couple more questions that I think we can answer here before we conclude. Here's one where, Tim, you may want to take the lead. Dave, I'm sure you'll have some feedback as well. What is the best way to let patients know we have a membership plan?
Well, I think that starts with Mary, right? When you have somebody calling to your practice brand new for the first time, and one of those questions is, how do I pay for this service? That's when you have a chance to talk about membership right then and there. And that's assuming that they're uninsured. So that's one way to do it, but there's many ways to do that. I mean, we oftentimes will tell the entire story on a website. So your whole story is on a web page. We call out on the homepage that you've got something like that. So if they land on the homepage of your website, they can get to your story and see what's going on there. Outside of that, there's paid advertising, ideas like Facebook. There's ways that you can market on Facebook, Google pay-per-click. And what we often do, like we said, I think that it's kind of hard to explain the nuances of membership through traditional advertising. If you get to all the details on there, I think it leads to more questions than maybe you want. So the whole idea is to tease it enough to generate that phone call where you can explain that, or take them to a landing page on your website that explains it in more detail. So there's lots of traditional and non-traditional ways to get people to that story, but what you really want to do is have them pick up that phone and call. Something that we're doing and seeing more of recently are adding chat features to your website. And so that's another way for you to engage with someone who might be just on your website. They might not normally call, they might not email, but if they see a little chat feature come up and it starts a conversation, you as a live human can jump in on that and start answering those questions. But again, I think the heart of all of it is, having a Mary on your team that's trained to help people understand the benefits of membership. They truly believe in it, and you believe in it as well. I think that with all those factors lining up, you have a really good chance of success.
And just to add to that, Tim, one thing we've seen is to that idea of being behind it and believing in it. We actually did some testing, and if the team at the dental practice talks about it from the heart and has a personal story to tell around it, it gets a ton of attention, and the value is only reinforced. So, for example, that front office, the front desk person talks about, hey, I've always wanted to be able to provide you care that's affordable. It's easy for you to, utilize. It's simple, it's transparent, and now I have that option. Like, is a great angle for the front desk. The hygienist being able to say, I know if you sign up for this, you're going to come in more often, and you're going to, I'm going to be able to keep your teeth cleaner, and it's going to improve your oral health, and that's what my job is. That's another good angle. And then for the dentist, we actually saw, this is interesting, is talking about this plan. I control. I'm direct with you. There's no hassles. There's no middleman, right? We decide on what care is going to be. You're going to accept. Like, again, just being honest and open and sharing those things. It goes a long way to showing the value and the belief you have in the membership plan.
Yeah, I couldn't agree more. And it kind of goes back to that whole slide about loyalty, right? If you build your practice around loyalty and belief in what you do, then having a membership plan that helps more people find that, you can get great dental care and it's affordable, transparent, and you believe in it, that all helps.
Yeah.
So we're going to squeeze one more question in here regarding renewals. What is the average renewal rate for membership plans?
Oh, another sort of nuts and bolts one. So the average renewal on the Kleer platforms, 80%. We have practices that are almost 100%. We have practices below 80%. And this actually gets to marketing, I think, Tim, where we see success. The ones that are successful are the ones who actually create a bond with the member and treat them special and make them feel good about being a member of the practice. And when you create that and you're offering a plan that's balanced, like from a value proposition perspective, the renewal rates go through the roof. So it's as much about that as it is about just the mechanics of the membership plan.
Great. So we are at the top of the hour here, and what a great presentation. Thank you both. If people did not get a chance to get their questions answered, I think that I can say they can go to the websites listed here on the slide. Is there any other ways that those listeners should reach out to either of you, or is that correct?
I'll give, I don't know, sure Tim wants to know, I'll give you my email. It's dave@kleer.com. If you're interested in, if you have a question or, something you want to talk about, please reach out there.
Yeah, what some of you may not know is that I actually have a business partner named Tim as well. So hence the name TNT Dental. But if you send to tim@tntdental.com, you'll reach either one of us. And we're both used to handling each other's emails, messages, things like that. So we're happy to answer any questions you may have and help take it to the next level.
Great. Well, thank you both. And thank you everyone for joining us today. Have a great one.
All right. Thank you.
Thank you.